Dr. K here with the Harris County ESD 11 Emergency Medical Service. It's warm, it's going to get hot. So we're outside, kids, dogs, family. It's going to be great. It's going to be a good summer. There are some problems you may encounter with the heat. So we have a question from a local student group. So take it away.
Hi, I'm Lexi and we're with Lunch and Learn. We have a question for you.
Hey, Dr. K. What are signs of heat stroke and how can I protect myself?
So that's a really good question and it's timely and appropriate. Let's talk a little bit about heat. So there's about 7,000 emergency department visits a year for heat-related illness and about 700 deaths. Most of those occur in these summer months. While it is equal across the United States, Texas, California, and Arizona lead that with a number of those illnesses and injuries. August is the prime month. Predominantly, that's when football training starts. The majority of what we see in heat-related illness and sport-related illnesses occur on the football field during these months. The kids have been out all summer, but again, are not necessarily acclimated to the amount of physical activity that they're going to be performing. You absorb heat from your environment, you give heat out to your environment. Our bodies are uniquely situated to try to manage the heat that's there. But there are some medical conditions that can result from excessive heat. These conditions range all the way from swelling in your feet, heat edema, to rash, skin rash, sunburn, prickly heat, up to heat tetany, heat cramps, heat exhaustion, and unfortunately heat stroke. Some of these are really very common. Swelling in your feet, heat edema is just from the circulation, your skin flushing, and you get a little bit of swelling in your feet. It's not dangerous, it's not related to a heart condition, and it usually resolves with rest and elevation. The second is prickly heat or a heat rash, and this is when the sweat glands become occluded or inflamed, etc., and you start to itch. Again, good hygiene, washing, keeping clean, etc., is a good way to kind of prevent prickly heat or heat rash. Then it starts to become a little bit more serious. When you start getting heat cramps, you start to get dizzy, lightheaded, maybe a little bit nauseated. Again, you're getting into heat exhaustion and trying to avoid heat stroke by recognizing the symptoms. Unfortunately, it's a very close step to heat stroke. Heat stroke involves the elevation of the body's core temperature up to and above 104 degrees. Certain portions of the population are a little more susceptible to heat illness and heat stroke. The extremities of age, the very young and the very old, are very susceptible. Those with medical conditions, particularly taking medications for heart problems, diuretics, taking medications for hormone-related issues, thyroid problems, mental health medications, medications for ADD, medications for depression, etc., diuretic medications. All the rest of this can basically impair your ability to deal with the heat. So now your body is uniquely set to be able to manage the heat. We deal with the heat several different ways. The first way is that with sweat. Our body acts like a car radiator. We circulate fluid to the skin flushes, the skin allows to sweat. That puts humidity and water on the outside of the skin, and that's evaporated. And we lose a lot of heat from radiating the heat out into the environment and evaporating that sweat off of our skin. So one of the ways to prevent a problem from happening is to keep yourself very well hydrated. How do you hydrate? Water is very, very important, but you're also losing electrolytes when you sweat. Drinking just water can actually lead to a dangerous condition where the body salts basically lower, so you really need to replenish the salts. The commercially available rehydration liquids that you see are very, very important, but again, some of them contain a lot of sugar just to make them taste good. The current recommendations, if you're going to use some of these commercially available sports drinks, etc., or packages of liquids or powders, is to basically mix about double the water that it's recommended, making sure you're well hydrated and you're getting the electrolytes back. So even if you live here, it takes a little while to acclimate to the change in the environment. Your body takes about 2 weeks through a hormonal process to kind of get you ready for the increased heat. Certain things you can do during that time period. One is to limit the amount of exertion and the time in the direct heat. What you wear, your clothing, is very, very important. Remember, we want to reflect heat off, so light colors, etc., are very important. Loose-fitting clothes is important. Clothing that will absorb the sweat and allow the wind and the breeze to kind of help cool you and move that off as well. You can't push your acclimation by not going into the air conditioning and staying out of a cool environment. Actually, it puts you a little bit of a danger. Now, you want to keep yourself really well hydrated, but what you choose and to hydrate yourself with is very, very important. Ice cold beer is fine, but the problem is that alcohol basically causes diuresis, loss of body fluids. A lot of alcohol changes your ability to make really, really good decisions. Can actually lead to a rapid progression to heat illness, heat exhaustion, and heat stroke. So you got to keep yourself protected. Protected from the radiation of the sun. You have a lot of heat loss through your head. Wear good head covering, wear good protection, be Texan. So there's a progression of heat injury. Starts with maybe some muscle weakness, maybe some cramps, some tetany where you actually get some spasm in your muscles. Leg cramps a lot easier than usual. This is a sign that you're getting dehydrated. This is a sign that your electrolytes are shifting. Your body temperature is also going up. You're losing the ability to kind of cool yourself. It's a very, very short window from heat exhaustion, feeling dizzy, lightheaded, not well, a little sick at your stomach, to heat stroke, alteration in your mental status, and particularly severe medical injury. So if you start feeling bad, if you start getting cramps, if you start feeling more tired than usual, if you get nauseated, you feel a little dizzy, maybe a little headache, you need to act very, very quickly because, again, it is a short window to a severe illness. What you need to do is immediately get yourself out of the heat. It is absolutely perfectly fine and preferable that you go into a nice cold environment. Don't be worried or afraid of going into air conditioning, out of the heat, etc. It's not going to be a bad problem. It's basically going to help you cool off as quickly as possible. Don't avoid going into a nice cold room as often as possible. So these symptoms are very, very severe and progressive. So what can EMS in the medical field do for heat illness? The first thing to do is to come get you checked and see where your temperature is and monitor that for the rest of the treatment. We have the availability to give you ice cold IV fluid and immerse you totally in an ice bath. We can do that immediately at the scene, etc. And it's probably one of the most important things is to get that temperature down closer to 101 and under 101 as rapidly as possible. So we need to talk a little bit about being in hot cars in the summer. The ambient temperature in the car can rise as much as 40 degrees over the outside temperature in as little as 1 hour. Most of that rise is in the first 20 minutes, even with the windows cracked, etc. At 90-degree temperatures outside, the inside temperature of this vehicle can get to be 120 to 130 degrees. Rapidly increasing body temperatures above that heat stroke level of 104 is very, very dangerous. A body temperature of 107 is fatal. What does Texas law say about children in cars? You're not allowed to leave a child in a car unattended, even if the windows are cracked. If you see a child in a car, you're allowed to go in and to rescue that child, using the appropriate force, calling 911, and staying with that child. If you have a question or concern that you'd like us to address, just reach out to us. Just say, hey, Dr. K. For the Harris County ESD 11 EMS system, I'm Dr. J. Kovar, and call us. We're ready, we're available for you.